Welcome back. This past weekend, the White House released the results of President Trump's latest physical, saying that he is in, quote, excellent health. Here to dive more into the results of that physical, 9 News medical expert Dr. Kohli. Dr. Kohli, we should all get a physical every year. But we're not all required to. The president is. Why is that?
That's exactly right. So 2 reasons. One, of course, is for good health, right? We need to check on his cancer markers. We need to screen him for cardiovascular disease. But more importantly, the annual physical, the executive physical, really does assess whether he's fit physically and mentally to serve as commander-in-chief and president of the United States. So it's a requirement, and they really assess him comprehensively to see what his decision-making capacity is, what his mental status is, and of course his physical health as well.
When a president gets a physical, you know, his age is going to come up. In this case, the president is 80 or about to turn 80 this month. Can we talk about his heart health? What do you know about his heart health from your standpoint?
So a few things stood out to me, Drew, as a cardiologist. Number one, he's on not 1 but 2 medications for cholesterol. One is rosuvastatin, one is ezetimibe. Normally, we use combination therapy when we really want to get that bad cholesterol down. And his looks beautiful, by the way. It's 53s, his LDL or bad cholesterol. But to me, that suggests that he may have some degree of blockage or plaque. Now, it's interesting because his physician noted that he had a CT scan in fall of 2025 that said no obstructive arterial disease. And that's a medical term we use. Obstructive usually means greater than 70% blockage.
Okay.
So it's possible that he has some degree of non-obstructive disease. So that was the first. Second, his kidneys, his liver, his thyroid all look in excellent health. His hemoglobin A1C or blood sugar better than mine, actually. So he's doing great there, despite some of the ways that the president eats. But really what else stood out to me is that they did an ultrasound or an echo of his heart. And this is important because remember last year there was that whole thing about swelling in his ankles.
Yes.
So we looked to see if the heart is weak. They said the heart is not weak. His congestive heart failure markers were not elevated. But one thing that was missing to me as a cardiologist was not just how it pumps, but how does it relax? Because we know that as we get older, our heart can get stiffer, and that's a different kind of heart failure that causes the ankles to swell up. So that was missing. And then this I thought was really interesting. His physician commented that his heart age is 14 years younger than his
actual age.
Yes,
wow, okay.
Based on something they said was an AI-generated EKG analysis. This is not something we're using clinically, so I was surprised to see that physician put it into the report because it's not been validated.
Still, you've had patients of all ages. You're looking at the test results of this 80-year-old or this near 80-year-old. Were you surprised by the findings?
I was surprised and I was very impressed by the overall findings. Now, what we're told is what we know, but what was really interesting and didn't sort of make sense is that they said that the president gained 14 pounds in the last year, right? So what one would expect is when you gain weight, usually your blood pressure goes up because weight and blood pressure track together. His blood pressure actually dropped 23 points from his physical last year, despite the fact that he's gained weight. So I thought that that was really interesting and surprising. Now, could it be that he was dehydrated that day or something else that made his blood pressure lower? Possibly, but that was an unusual finding.
When you were thumbing through these results, did anything stick out as missing in your opinion? Like, hey, where the heck is this or that?
So a couple of things that I thought could have used more detail. One, they commented on the swelling in his ankles being better than last year. Now, if he's gained weight and he has a condition called venous insufficiency, they should be more swollen, not less, unless he's had an intervention on those veins, like a venous ablation or something like that. So that was missing. And then sleep apnea. President is overweight, nearly obese, borderline obese. He's an older gentleman. We know sleep apnea is very common in this type of a patient population, and we know that he has a tough schedule. So it would have been nice to know whether they did a sleep test on him and assessed him for sleep apnea.
Do you recommend a physical to your patients every year, every couple of years? I mean, what is the actual recommendation?
Every single year. And just like the president, got to get your vaccinations up to date. That was an important thing they mentioned. Check those heart markers, check the cancer markers, make sure you're checking all those boxes.